So we're going to look at when to use an ANOVA in sports rehabilitation and injury prevention. So an ANOVA means Analysis of Variance, and it's a stats method used to compare the means of 3 or more groups to see if there are statistically significant differences between them. It's particularly useful when you want to understand whether a certain factor or factors affect a particular outcome across multiple groups. So we're going to look at examples when to use an ANOVA from sports rehabilitation and injury prevention. So you could compare the effectiveness of different rehabilitation programs. So say you want to compare the effectiveness of 3 different rehabilitation programs on improving knee strength in athletes recovering from ACL surgery. You have 3 groups of athletes, each undergoing a different rehabilitation program. An ANOVA can be used to determine if there are significant differences in the knee strength outcomes among the 3 groups. You measure knee strength in each group after the rehabilitation period and use an ANOVA to test whether the average knee strength differs significantly across the 3 programs. You could use it to evaluate injury prevention strategies. So you're studying the impact of different warm-up routines on the prevention of hamstring injuries in football players. You have players following 3 different warm-up protocols. An ANOVA can help determine if there is a significant difference in the incidence of hamstring injuries between the groups. So for example, after a season, you can compare the injury rates among the groups using an ANOVA to see if any of the warm-up routines significantly reduce the likelihood of hamstring injuries. You could use it to assess recovery times across different treatments. So you might want to compare the recovery times of athletes who receive different types of sports therapy or rehabilitation after a sprained ankle. An ANOVA can be used to assess whether the average recovery time differs significantly across different treatment methods. So athletes are divided into groups based on the type of treatment they receive, and their recovery times are recorded. An ANOVA is then applied to see if the types of treatment has a significant effect on the speed of recovery. So why should you use an ANOVA? You could use it for multiple group comparison. So an ANOVA is ideal when you need to compare more than 2 groups, as it prevents the increased risk of type 1 errors, which are false positives, that would occur if you performed multiple t-tests. Understanding variability. It helps to understand whether the variability in your data is due to the factor you are studying, for example, type of rehabilitation program, or just random chance. So in summary, an ANOVA is used in sports rehabilitation and injury prevention when you want to compare the effects of different treatment programs or strategies on an outcome across multiple groups. Now, examples include comparing rehabilitation programs for ACL recovery, evaluating warm-up routines for injury prevention, and assessing recovery times for different treatments. By using an ANOVA, you can determine if there are significant differences between groups, which can guide clinical decisions and improve outcomes for athletes or patients.